most famous physical therapist on the internet.
Hi, folks. I'm Bob Schupp, physical therapist.
Brad Heineck, physical
Together,
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad's opinion. It
That's
really means
right.
a lot to me. Today, we're going to talk about restless leg syndrome.
Ooh.
A lot of, it's funny, Brad. I was just thinking, I don't know anybody who has RLS. And then I'm talking to our cameraman, and he gets it once in a while.
That I was here listening, Bob. I was not
All
zoned
right.
out. So
All
yeah.
right. So, a lot of people use medication to help control it. And we're going to talk about what it is too. But if you don't want to do that, or it hasn't worked for you, or maybe you want to do it in addition to the medication, we're going to show you a solution here.
Sure.
Now, what is restless leg syndrome?
That's a good question, Bob. As a therapist, I know because I've had people, and it's very difficult to give them options. And so this is a great option. Yeah.
It's generally a long-term disorder that causes a strong urge to move your legs. And as our cameraman said, it happens often at night.
Right.
So that's really like the worst time for it to happen. It's an unpleasant feeling. It often improves by moving them. And that's what Tanner said. He walks around at night because he can't sleep.
Right.
It can cause aching, tingling, crawling. That's what people talk.
Yeah, kind of like those nerve symptoms you might
Right.
feel with sciatica or something
Occasionally, the arms might be affected. I don't know, Tanner? Not
with
the arms
Tanner.
and Tanner. Okay. So the problem is, it's very disturbing to the sleep.
Right.
I mean, it's really gonna affect you, and you're gonna cause you to become irritable and cranky, and
Right.
we don't want that.
Yeah, that's not desired, Bob. And so what are we going to do, Bob?
So
what is this option? Is this something here?
Yeah, this is the brand new Bob and Brad compression system. I guess we call it leg massagers.
Right.
And I've tried many of these before, Brad, and they were okay. But this one has really got good compression.
Sure, squeezes.
Yeah, it squeezes the heck out of my legs. So, and you can choose it. I mean, you have 3 intensities here.
So yeah, it's just not all on. You can vary that.
Now, what also the modes has got 3 or 4 different modes, but you can do just the foot. You can do the calf and the foot.
Yep.
And you can just do the thigh.
Sure.
But you can't do all of them at once.
So you Velcro those around. Bob has already done that, and there's a pump here that pumps it up, and here's the hoses that control the airways. And it's right as we speak. It's
doing its thing, Brad. I'm gonna put up the intensity, see if I can make you pop, baby.
So these are popular with people who are athletic and whatnot for recovery, but also we've got 2 studies on restless leg syndrome using these.
Right. Very successful. They weren't a large number of patients.
Right.
That's what my only warning is. But there was actually some people that actually resolved their problem, actually took it away.
Just in one night?
I don't know. They didn't give the details.
Right.
How long it took, but I think I'm assuming it probably took a couple of weeks.
Sure.
But so I'm gonna give you the title of these studies. So
Okay.
you can look up yourself. Look them up yourself. Sequential. I can't say it. Sequential compression devices for treatment of restless legs syndrome.
Right.
And the other one is called pneumatic compression devices are an effective therapy for restless leg syndrome. A prospective, randomized, double-blinded, sham-controlled trial.
Whoa, that one really got
was
some weight to it then.
Now, in that study, they wore it an hour before bed. They had no side effects, and again, really good results.
Sure.
So this one also has 2 settings of heat.
Oh, so
it doesn't get too warm.
Right.
I mean, it's enough that you feel it, but
so you probably don't have to worry about burning your legs.
No, I don't think
fall
so.
asleep with it
I'm
on.
Put on right now, but there it's pumping away. So, but you can put this on for like an hour before you go to bed. While you're watching TV, relax.
Yep.
And then see if it works the magic and takes away your RLS.
So you're gonna put it on and maybe, but you don't have to sleep with them on all night then.
No, no.
Oh,
I
okay.
wouldn't do that by any
Okay.
means.
Yeah. Yeah. I'd be pretty uncomfortable
We won't be able to sleep
with
with
all the
that then.
gadgetry. Mhm.
Right. So again, it works very well. I also saw a study that works very well for people who get sore legs. Maybe if they have to stand all day,
Mhm.
I mean, it's going to help you release some
Right.
pressure.
When you feel like your legs are maybe a little swollen and it's just,
Right,
yeah.
right,
And those compression socks, some people wear those to help with that.
right.
This would be a good option at the end of the day to
I don't know that if you had a swelling problem per se, like congestive
edema.
heart failure or
Oh,
something like that, you shouldn't be doing this. Then.
right.
You,
Right.
you always want to check with your doctor on those cases.
Exactly.
But otherwise, for minor swelling that you get just from being on your feet all day, I have no problem with that.
Sure. Yeah, this is nice that it plugs in to the wall.
Yeah, and it
110
all
volts.
sticks together too because
Sure.
of the tubing,
Hmm.
so you don't get lost. I mean, I've seen some that had all separate pieces,
Yeah.
and my gosh, it took me forever to figure out how to put it on. I mean, but this was very user friendly.
Sure.
So, and I hate to always say this because by the time I say this, and they no longer have it, but they have a $10 off coupon right now.
Oh.
So, check it
Otherwise,
out.
they can go below our video and there's a link to this or get
There
to.
should be something we can link to. We're really organized here, are we?
Ah,
So, anything else you want to say, Brad?
Good luck.
Yeah, good luck in dealing with
No.
us.
Yeah, things are. It's an interesting option that they're becoming more and more popular.
Yeah.
So very good. Enjoy the day.